Hello everybody. Good evening. Today we are going to study oncology multiple choice question challenge. So remember, oncology means all the cancers, their etiology, their pathogenesis, their staging, their diagnosis, their treatment. And the thing is that a major chunk of questions, about 40 in NEET PG, come from the oncology part may be divided in different parts. It can be ophthalmic oncology, it can be pediatric oncology, it can be orthopedic oncology. So let's begin with it. Tumor exclusively seen in parotid gland is, well, from the image you can look it very carefully. A. Mucoepidermoid. B. Adenocystic. C. Warthin tumor. D. Pleomorphic adenoma. Well, from the image you can see it is a Warthin's tumor. The important points regarding Warthin's tumor is that it occurs exclusively in the parotid gland. It is most common in males, it is most common in smokers, it is most common in lower pole of parotid at the angle of mandible. 10% of the cases are bilateral. Warthin tumor, the salient features are occurs exclusively in parotid gland. It is most common in males, most common in smokers, most common in lower pole of parotid gland, and that is at the angle of mandible. And 10% of cases are bilateral. So the correct answer here is C. Fish classification is used for. From the image, you can see the fish classification. The C1 is limited involvement of vertical portion of carotid canal. C2 is involvement of vertical portion of carotid canal. C3 is involvement of horizontal portion of carotid canal. So the fish classification is used for A. Paravertebral tumors, B. Synovial sarcomas, C. Glomus tumor, D. Retroperitoneal tumor. This fish staging in ENT is used for glomus tumor. Glomus tumor. So the correct answer here is C. Glomus tumor. Let's move to the next question. Best prognosis for all thyroid cancers is A. Papillary, B. Follicular, C. Medullary, and D. Anaplastic. So the best prognosis for all thyroid cancer is papillary cancer, and the worst prognosis is anaplastic cancer. So the correct option here is A. Papillary cancer. In case of CA breast, that is carcinoma breast, with HER2 new amplification, when will you do FISH, that is fluorescent in situ hybridization? A. HER2 new 1 plus, B. HER2 new 2 plus, C. Irrespective of HER2 new, D. HER2 new 3 plus. Now, the NCCN guidelines for CA breast, HER2 status of cancer breast is routinely done by immunohistochemistry test with values from 0 to +1, +2, +3. Recently, FISH, that is fluorescent in situ hybridization, is used to detect HER2 amplification and advised for ISC HER2 positive cases of values +2 onwards. 20% incidence is detected and treated by trastuzumab, that is HER2 receptor inhibitor. So the correct answer here is HER2 new 2 plus, that is B. Most important prognostic factor for carcinoma esophagus is A. Length of growth, B. Depth of involvement, C. Histology grading, D. Immunohistochemistry. The prognostic factors for carcinoma esophagus are number 1, depth of invasion, number 2, lymph node status, number 3, presence of distant metastasis, number 4, resection margin, number 5, serosal or peritoneal involvement, and number 6, vascular invasion. So the correct answer here is B, depth of invasion. Which of the following is not true about GIST? A. Rarely occurs in stomach and duodenum. B. Universally associated with C-KIT oncogene mutation. C. Size and mitotic index are best predictors of metastasis. D. Sensitive to hematology. Now, this GIST, gastrointestinal stromal tumor, is most common in stomach, 50%. These are of mesenchymal origin. It is equal in males and females. Universally associated c-KIT oncogene mutation. Imatinib, that is tyrosine kinase antagonist, has 80% response rate on treatment. Mutation in exon 11 of c-KIT are particularly sensitive to drug. Size and mitotic index are best predictors of metastasis. Clinically, GIST are very rare of all the GIT tumors. So the correct answer here is A, rarely occur in stomach and duodenum. Increased level of 5-HIAA hydroxyindole acetic acid is seen in which disease? A. Carcinoid tumor. B. Phenylketonuria. C. Pheochromocytoma. D. Gastrinoma. The correct answer here is A. Carcinoid tumor. Okuda staging. Okuda staging is for A. Hepatocellular cancer. B. Pancreatic cancer. C. Hepatoblastoma. D. Renal cell carcinoma. Okuda staging is used for hepatocellular cancer. Identify the triangle shown in the image. A. Callots triangle. B. Hepatocystic triangle. C. Gastronoma triangle. D. Dooms triangle. It is the gastronoma triangle. It is also called the Passaro triangle. About 70 to 90% will be located in this triangle. It is at the junction of CBD and cystic duct, junction of neck and body of pancreas, junction of second and third part of duodenum. So it is gastronoma triangle. Most common presentation of bile duct cancer is A. Pruritus, B. Jaundice, C. Gallbladder involvement, enlargement, D. Weight loss. So the correct answer here is jaundice. Most common presentation of patient is with jaundice or elevated left. The gallbladder is palpable in distant growth due to obstruction. That is Courvoisier sign. Minority cases present with itch. So the correct answer here is B. Jaundice. Most common site of cancer penis is A. Glans penis, B. Prepuce, C. Shaft, D. Coronal sulcus. It is glans penis. Recent FDA approved drug has first line treatment along with platinum based chemotherapy is stage 4 NSCLC. A. Erlotinib, B. Jeptinib, C. Sorafenib, D. Crizotinib. Administration of approved Jeptinib for first line treatment of patient with metastatic non-NSCLC with most common type of EFGR mutation. This Jeptinib is a EGFR inhibitor. So the correct answer here is B. Jeptinib. Chan staging is used for A. Retinoblastoma, B. Pentoblastoma, C. Ewing sarcoma, D. Rhabdomyosarcoma. Let us see Chan staging. M0, no evidence of metastasis. M1, tumor cells found in cerebrospinal fluid. M2, intracranial tumor beyond the primary site. M3, gross nodular seeding in spinal subarachnoid space. M4, metastasis outside the cerebrospinal axis. So the correct answer here is B. Medulloblastoma. Craniopharyngioma is a brain tumor arising from A. Rat case pouch, B. Neurohypophysis, C. Posterior pituitary, C. Median eminence. This craniopharyngioma is a brain tumor arising from rat case pouch. These are benign cystic lesions that occur most frequently in children. So the correct answer here is D. Median eminence. Most common pituitary adenoma are A. Growth hormone secreting adenomas, B. ACTH secreting adenomas, C. TSH secreting adenomas, and D. Prolactinoma. 30% of pituitary adenomas are prolactinomas, 20% are non functioning, 15% secrete growth hormone, and 10% secrete ACTH. So the correct answer here is D. Prolactinoma. Most common intracranial brain tumor in adults is A. Astrocytoma, B. Metastasis, C. Meningioma, D. Oligodendroglioma. It is metastasis. So the correct answer here is B. Kaposi sarcoma is caused by A. HIV-1, B. HPV-16, C. HTLV type 1, D. Human simian virus 40. So the correct answer here is A. HIV-1. HIV type 1 causes Kaposi sarcoma, HPV 16 and 18 causes cervical and anal cancer, HTLV type 1 adult T cell leukemia, H. pylori gastric cancer, cystosoma hematobium carcinoma urine bladder, opisthosist cholangiocarcinoma. So Epstein-Barr virus causes Burkitt lymphoma, Hodgkin's disease, uh, nasopharyngeal cancer. Hepatitis B causes hepatocellular carcinoma. Hepatitis C causes hepatocellular carcinoma. HIV type 1, Kaposi sarcoma, HPV 16 and 18, cervical and anal cancer. HTLV type 1, adult T cell leukemia, H. pylori gastric cancer, histosoma, hematobium carcinoma, urinary bladder, opisthochosis, cholangiocarcinoma. Soft tissue tumor of extremity most commonly metastasized to A. Lung, B. Liver, C. Bone, D. Lymph node. Most common site of distant metastasis is the lung, followed by bone, liver, and brain. Metastatic workup, CT chest lung metastasis is extremely common. So the correct answer here is A. Lung. Most microsurgery is done for A. Cutaneous melanoma, B. Dermatofibrosarcoma, C. Squamous cell carcinoma of skin, D. BCG of face. This most microscopically oriented histographic surgery, that is most micrographic surgery, is performed for basal cell carcinoma of face. So the correct answer is D. Most common type of soft tissue sarcoma in children is A. Embryonal rhabdomyosarcoma, C. B. Alveolar sarcoma, C. Liposarcoma, D. Leiomyosarcoma. Most common soft tissue sarcoma in children. Most common non-ocular orbital tumor, most commonly seen in head and neck. So the correct answer here is embryonal rhabdomyosarcoma. Please click the link in the description box to join the 2-day Ultimate Neet PG Breakthrough Blueprint event. It is a 2-day event covering all the 19 subjects in a holistic manner. The first 10 people who click the link in the description box and join the WhatsApp group will be given this class absolutely free. The tumor with high frequency of spontaneous regression in children is A. Medulloblastoma, B. Renal cell cancer, C. Lung cancer, D. Retinoblastoma. It is medulloblastoma. High frequency of spontaneous regression. Other tumors are malignant. It is the medulloblastoma. Pheochromocytoma at extrarenal are most commonly located in A. Posterior mediastinum, B. Superior mediastinum, D. C. Anterior mediastinum, and D. Middle mediastinum. It is usually the posterior mediastinum where the pheochromocytomas are present. So correct answer here is C. Idea of adrenal biopsy should be made after ruling out. Always rule out pheochromocytoma before doing any adrenal biopsy because it will be very dangerous if you touch this tumor. Most common malignancy of vagina in children is A. Embryonal rhabdomyosarcoma, B. chondrosarcoma, C. Melanoma, D. Leiomyosarcoma. It is embryonal rhabdomyosarcoma. Frey syndrome is due to injury of which of the following nerve branch? It is a trigeminal nerve, B. Vagus nerve, C. Facial nerve, glossopharyngeal nerve. Correct answer here is trigeminal nerve. Auriculotemporal nerve is the postganglionic parasympathetic nerve, which on injury during parotid results in gustatory sweating syndrome known as Frey syndrome after 2 to 3 months. Wishing you all the best. Click the link in the description box and be the first 10 people joining this masterclass absolutely free. Wishing you all the best.